This podcast is talking about what the trichophytic closure means. And I think the trichophytic closure has meaning in both the world of facial plastic surgery that I perform, as well as in hair transplant surgery. So I'm going to talk about the trichophytic closure both in context of this for facelifts and for hair transplants. So forgive me if you're more interested in hair, if I'm talking about the face and vice versa. So what a trichophytic closure is essentially active and intentional transection. Transection meaning cutting or amputating, cutting through hair, intentional cutting through hair, in order for when you put the wound back together, that the hair will actually grow through the incision. So the facelift, for example, the reason why my facelift incisions are so difficult to see, besides there's a tension-free closure, the fact that the rotational flaps are in good alignment, and is the fact that in the hair-bearing area in front of the ear and in the behind the ear where there's an incision along the hairline, I actually bevel the blade intentionally sideways so that I can cut one row of hairs, intentionally cutting through one row of hairs. And then what happens is those partially cut hairs will then grow through the scar and make that scar very hard to see. It was first sort of invented, if you will, in the brow lifts. I don't believe in brow lifts for the most part in terms of large incisional brow lifts. I don't think they do very much except leave people bad scarring. But that was what the first trichophytic closure was performed, was along the hairline. I do it for facelifts and for closure of FUT or incisions behind the head for non-FUE based hair transplants. I still perform quite a few FUT procedures, but that's how I do it for facelifts. Now, it's a little bit different when I'm doing a hair transplant. I'm doing it very differently in the sense that compared to a facelift. So first of all, why would even someone want to do FUT or strip procedures? This seems like an outdated dinosaur of a procedure. And well, one is if you wear your hair very long, it makes no sense, in my opinion, to have to shave all of it off. The second benefit is for women. Women don't need to shave the area. And third is FUE oftentimes depletes the donor area fast. Fourth of all, if the crown is very low and they have advanced baldness with a very narrow strip, there's no way I have ability to harvest FUE. So there's a million reasons why the strip procedure is still, to me, incredibly good. Now, there are a lot of reasons why a strip is not good. FUE is great for someone wearing very short hair. The hair shingles in a bad angle. They've got more limited loss. There are a lot of indication where FUE does actually is far superior than a strip procedure. But I just wanted to preface that with that comment. Now, the way that I do a harvest strip method and do a trichophytic closure is very different. So what I first do is I do a lot of tumescence, which is basically fluid to make sure I actually don't transect. I don't want to cut through hair. I want to give a clean harvest. So I first intentionally get a very, very clean harvest. Then I take that clean harvest, give it over to my staff to make the dissection. And then at the end, right before I close the incision, I then take a millimeter across the bottom lip, intentionally transecting the outer hair of the bottom lip. The reason I don't transect while during the harvesting process, if I do that, I'm going to chop through hundreds and hundreds of hairs that would be valid for transplantation, and that would be terrible because those hairs are needed for transplantation, and the wound would not heal well. It would actually compromise wound healing. But once I've got a very clean, minimal to no transection harvest with a strip, then what I'll do is if there's not excessive tension, if there's excessive tension on the wound, then the trichophytic closure will actually hurt it. But if there's not excessive wound tension, then I'll take a little tiny 1 millimeter lip of skin from the bottom edge, taking a little hair with it along that edge. And that way, when that upper flap hangs over the bottom lip by 1 millimeter, the hairs will grow through the scar to make it much harder to detect the scar. So that's how I use a trichophytic closure in both face and hair surgeries.